Hi everyone and welcome to our functional movement analysis. This is Stella, a 20-year-old female who is a white-collar worker. Sometimes she loves to enjoy a cup of sparkling water or some beverages to refresh herself during tea time in office. In this movement analysis, we will be analyzing 3 tasks she made to enjoy her refreshment. As we can see, the first movement of Stella is that she's reaching for the cup in the cupboard. There are 4 main joints involved in this motion, which includes the glenohumeral joint, the elbow joint, the radiocarpal joint, and the sternoclavicular joint. Stella needs to raise her hand superiorly by concentric contractions of prime muscles like deltoid and pectoralis major around glenohumeral joint, which is stabilized by the rotator cuff to grab a cup. Also, elevation of clavicle created by concentric contraction of superior trapezius and serratus anterior around the sternoclavicular joint helps to finish this motion. And during this motion, her right arm is firstly flexed concentrically by the biceps brachii and brachialis, and then extended concentrically by the triceps brachii. The stabilizer of elbow joint is acromius. The last joint we are going to analyze is the radiocarpal joint, which is the wrist joint. As her hands trying to grab a cup, the wrist must ulnar deviate with gravity. At that time, flexor carpi ulnaris and flexor carpi radialis need to contract eccentrically against the force of gravity. Meanwhile, concentric extension of the wrist is required to hold the cup, which is primarily driven by the extensors, like extensor carpi radialis longus, extensor carpi radialis brevis. All flexion and extension movements I've mentioned above occurred on sagittal plane and their axis is frontal. The deviation and elevation movements occurred on frontal plane and their axis is sagittal. You may refer to this table which concludes all the movement analysis about the task 1 movement. We are now focusing on the movement of twisting of the cap of the bottle drinks. 4 major joints include in this task: the interphalangeal joint, the metacarpophalangeal joint, and the radiocarpal joint, and again the elbow joint. The role of the elbow joint here is to be flexed isometrically by the biceps brachii and the brachialis to maintain the angle of forearm to make the fingers work easier during the whole movement. Also, the radiocarpal joint is flexed with gravity. Extensors like extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris need to contract eccentrically against the force of gravity. Now, let's take a closer look at the fingers. Flexions of fingers occurred at their metacarpophalangeal joints and the interphalangeal joints. For the metacarpophalangeal joints, the main muscle actuators are the flexor pollicis brevis and flexor pollicis longus. They are contracting concentrically. For the interphalangeal joints, including the proximal one and the distal one, the prime muscles are the flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus, which are contracting concentrically as well. The dorsal and palmar interossei help to complete the flexions. All joint movements here occurred on the sagittal plane and the axis is frontal. The detail of this analysis is shown at this table for your reference. The last task Stella needs to do is pouring the sparkling water into her cup. In this task, she's going to use her glenohumeral joint, scapulothoracic joint, radioulnar joint, and carpometacarpal joint. Cylindrical gripping of the bottle is maintained by the isometric extension of carpometacarpal joint of 2nd digit to 5th digit, and the isometric flexion of the thumb. The axes of these movements are frontal. And next, To pick up the bottle, upward rotation occurs on the frontal plane and sagittal axis, with scapulothoracic joint is performed. The responsible muscles are trapezius and serratus anterior, which are concentrically contracted. The third joint involved in this task is the glenohumeral joint. Medial rotation on the transverse plane and longitudinal axis of this joint is mainly produced by the concentric contractions of latissimus dorsi, teres major, and anterior deltoid. The stabilizer of glenohumeral joint and scapulothoracic joint is rotator cuff. Lastly, to pour the drinks into the cup, Stella needs to pronate her forearm with concentric contraction of the muscles called pronator quadratus and pronator teres. This movement occurs on the transverse plane and its axis is longitudinal. The analysis of task 3 movement is concluded in this table. Now, we are going to make an environmental change so that Stella can finish her task 1 easier, like placement of a step stool. As we can see, longer reaching for cup is prevented after she climbs up the ladder. The flexion degree of glenohumeral joint and the elevation of sternoclavicular joint decreases. As a result, the degree of scapular rotation decreases either due to scapulohumeral rhythm. In addition, the required extension degree for the elbow joint also decreases. Stella doesn't need to fully extend her arm to get that cup right now. Consequently, less strength of contraction of the upright muscles are required. Like deltoid pectoralis major for the glenohumeral joint, superior trapezius and serratus anterior for the sternoclavicular joint, and the triceps brachii for the elbow joint. So it is easier for Stella to get that cup now. And that's the end of our functional movement analysis. Thank you for watching.